So yeah, some exciting changes. We're really implementing a package of care for our patients that might have sustained spinal injury. There's a few aspects to that. I guess the main headline one would be that we're no longer using the semi-rigid collars. The second thing would be we have changed the approach to who we suspect spinal injury in. So there's less emphasis on the young, healthy, fit patient who very rarely damages their spine, and there's a far more emphasis on our frail elderly population who we know damage their spine quite easily with quite small mechanisms, and there's a much greater focus on them. Another thing we're doing is we're moving away from a one-size-fits-no-one approach of strapping someone down to a board, which in a lot of our patients, especially the elderly, is a horrible thing to have done to them. So in those patients we're promoting a position of comfort approach, anything we can do to encourage the patient to keep their neck still. And what we're doing is we're going to use one of these lanyards, and this is just a flag to the emergency department when we arrive that this patient, although they look a bit different to what they used to with the old method, this patient still might have a spinal injury, and that needs to be looked at before they move on. The collars have always been a bugbear of mine, as they have been, I know, for pre-hospital clinicians up and down the country. So a few years ago I set up a working group to try and look at the outdated guidelines that we were using, and had great support from the Trust, great support from our medical director. We managed to come up with a set of guidelines based on modern evidence which we thought were really good. We approached JR Kelk, who set the national guidance, and they got us on board and they worked with us, and we're going to be the first to adopt these guidelines, and hopefully over the next few months you'll see them roll out nationally.